You went to bed last night feeling completely fine. No chest pain, no dizziness, no warning signs. And yet, while you were asleep, your brain may have been experiencing restricted oxygen flow. Not because of a disease, not because of a medication, but because of the exact position your head was resting in when you closed your eyes. I need you to hear this carefully because what I'm about to share has nothing to do with diet, nothing to do with exercise, and your doctor has probably never once brought it up during any of your checkups. My name is Dr. Evans, and over the years I've spent reviewing cardiovascular and neurological research for patients in their 60s, 70s, and beyond. I've seen one silent pattern that almost nobody in mainstream medicine talks about openly. The way you sleep, the angle of your neck, the direction your body faces, the position of your spine is actively influencing how well blood reaches your brain every single night. And here's the part that stops most people cold. Stroke risk peaks in the morning hours after waking with a 49% increase between 6 a.m. and noon, driven by the morning blood pressure surge. That isn't a coincidence. And what happens during the hours before that window, how you sleep, what position you're in, whether your body is properly recovering overnight, directly determines how vulnerable your cardiovascular system is when that surge hits. So before you dismiss this and say, "I've slept this way my whole life," I want you to stay with me because in the next 18 minutes, I'm going to walk you through 6 sleeping mistakes ranked from surprisingly harmful to genuinely dangerous. And then, I'm going to give you 2 evidence-backed positions that could be doing your brain and heart a real favor tonight. But right now, before we go a second further, do me a quick favor. Drop a comment below and tell me, are you a back sleeper, a side sleeper, or a stomach sleeper? I'll be referencing all 3 throughout this video, and your answer is going to matter very soon. Let me give you some context before we get into the list because understanding the why is going to make everything else make sense. When you're young, in your 20s and 30s, your blood vessels are elastic. They stretch, they adapt, they compensate. Even if you sleep in a weird position, your cardiovascular system quietly corrects for it. You wake up with a stiff neck, and that's usually the end of it. But here's what changes after 60. Your arterial walls begin to stiffen. The small vessels feeding your brain become less flexible. The pressure inside your skull becomes more sensitive to changes in body position, and your blood pressure regulation system, the one that keeps everything balanced, becomes slower to respond, especially at night. Doctors call this overnight blood pressure dipping. Healthy sleepers experience a natural 10 to 20% drop in blood pressure during sleep. This is protective. This is your body recovering. But if your sleep position is wrong, if it's compressing the wrong vessels, restricting the wrong airways, or tilting your blood flow in the wrong direction, that natural protective dip gets disrupted. And what fills that gap is something far less friendly. That's the framework I want you to carry into everything that follows. Now, let's get into the list. Before we continue, tell me your name and where you're watching from. I read every comment, and I'd love to know who I'm helping today. Mistake number 1, sleeping fully flat without any head elevation. Let's start with something that sounds so benign it's almost hard to believe it could cause a problem. Sleeping completely flat. No pillow or just a thin one. Body perfectly horizontal. Spine supposedly aligned. It sounds ideal, right? Physiotherapy websites praise it. Websites. Mattress companies build their marketing around it. But there's a critical piece of the picture that nobody's showing you. When you lie completely flat, particularly after age 60, blood doesn't distribute evenly the way it does in a younger body. In the absence of gravity working in your favor, cerebro's spinal fluid, the fluid that cushions your brain inside your skull, can pull. Intracranial pressure edges upward. The tiny vessels in your brain that are already dealing with years of mild wear are now under slightly more pressure than they should be for 7 to 8 hours straight. A study published in the Journal of Clinical Sleep Medicine found that even modest head elevation, as little as 15 degrees, led to measurable improvements in intraradial pressure and nighttime blood flow dynamics. Now, here's the symptom most people completely misread. You wake up at 3 a.m. with a dull, throbbing headache. Maybe behind your eyes, maybe at the base of your skull. You think, I'm getting older. Headaches happen. You take a glass of water, maybe an ibuprofen, and go back to sleep. But what if that headache is your brain's way of saying the pressure in here is too high, and it's been too high for hours? The fix here isn't complicated. It's a 15-degree elevation of your upper body. And I'll show you exactly how to achieve that safely toward the end of this video. But first, let me tell you about something even more specific. Mistake number 2, stomach sleeping. The position that twists everything. Here's one that surprises almost everyone I bring it up with. Because stomach sleeping feels like it should be harmless. You're not putting weight on your heart. You're not compressing your lungs. It's just lying face down. What's the big deal? The big deal is your neck. When you sleep on your stomach, you physically cannot breathe with your face straight into the mattress. So, what do? You rotate your head to one side, typically the same side, every single night because we are creatures of habit. Now, think about what that means structurally. Your neck is rotated up to 90 degrees for 7, 8, sometimes 9 hours per night. And running along the sides of your cervical spine, the bones in your neck are 2 arteries called the vertebral arteries. These vessels carry blood directly to your brainstem, your cerebellum, and the regions of your brain responsible for balance, breathing regulation, and coordination. When your neck is rotated significantly to one side for prolonged periods, these arteries can become kinked. Think of it like stepping on a garden hose. The flow doesn't stop completely, but it becomes restricted. And restricted flow to your brainstem for 8 hours, night after night, year after year, is not something your body simply shrugs off. Research published in the Journal of Manipulative and Physiological Therapeutics confirmed that extreme cervical rotation measurably reduces vertebral artery blood flow velocity. The study was originally focused on chiropractic manipulation, but the anatomical principle applies directly to sustained sleep positions. There's also a second problem with stomach sleeping that affects breathing. Your ribcage is pressed against the mattress. Every breath you take all night is a breath fighting against compression. Your diaphragm can't fully descend. You never reach full tidal volume, the deepest, most restorative breath your lungs are capable of. Lower oxygen per breath. Restricted artery, both happening simultaneously. For a 35-year-old, the body compensates. For a 68-year-old with any degree of hypertension or cardiovascular history, this is a cumulative problem building silently in the dark. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this mistake number 3, stacking multiple pillows under your head. I want to stay in the neck region for a moment because the next mistake is one that people do with the best of intentions, and it creates a very similar problem through a completely different mechanism. Stacking pillows, 2, 3, sometimes 4 of them all under your head. People do this for real reasons. Acid reflux, sinus drainage, breathing difficulties, snoring. And a small amount of elevation does help with some of these issues. I'm not dismissing that. But here's what happens when that elevation becomes excessive. Your head gets pushed forward significantly, your chin tilts toward your chest, and that forward bend of the neck, what clinicians call cervical flexion, is exactly the position that compresses the vertebral arteries we just discussed, but this time from the front. There's also a third vessel that gets overlooked in this conversation, the internal jugular vein. This vein is your brain's primary drainage pathway. It carries used deoxygenated blood back down from your brain toward your heart. When your neck is bent forward excessively, the jugular drainage pathway becomes partially obstructed. blood drains less efficiently. Pressure inside the skull builds slowly, and the brain's ability to clear metabolic waste overnight becomes compromised. You might notice this the next morning as brain fog, a heaviness behind the eyes. That frustrating feeling of waking up from 8 hours of sleep and still not feeling rested. You're not lazy. Your brain may have literally been waterlogged overnight. The correction: one pillow, one properly contoured pillow. Ideally, a memory foam cervical pillow that supports the natural curve of your neck rather than forcing your head into an angle. Many of my patients have reported their morning headaches disappeared within a week of making this single change. One pillow. That's it. Before I show you the next mistake, if this is helping you rethink how you sleep, do me a small favor and hit the like button. It helps this kind of practical information reach more people who are waking up tired and don't know why. And tell me in the comments, how many pillows are you currently using at night? 1, 2, or more? I read every comment, and I'm really curious to see how common this habit is. Mistake number 4, right side sleeping with cardiovascular history. Now, we're getting into territory that is going to surprise a lot of you, because side sleeping in general is considered one of the better positions. And for most people, it is. But, and this is a significant, but the direction you face matters more than most people realize. Your heart sits slightly left of center in your chest. It has a natural orientation, and when you lie on your right side, gravity pulls your heart slightly away from its optimal resting position. More importantly, your body weight compresses the right side of your torso, and the inferior vena cava, one of the body's largest veins, runs directly through that region. The inferior vena cava has one job: return blood from everything below your waist, your legs, your abdomen, your digestive organs back up to your heart. When you compress that vein by lying on the right side, the return flow becomes restricted. Your heart has to work against reduced preload, which means it's pulling harder than it should just to fill each chamber properly. For a healthy person, this is compensated for easily. But for someone over 60 managing borderline heart function, mild heart failure, or chronic high blood pressure, your heart is already running close to its ceiling. Adding unnecessary nightly resistance is like running your car engine 10% harder every single night for years. The cumulative wear is real. The European Journal of Heart Failure published findings that patients with heart failure naturally and instinctively avoided right-sided sleeping. Their bodies had detected the discomfort before their minds consciously identified why. That instinct is worth listening to. If you commented right-side sleeper earlier, this one was written for you. Keep watching, because the solution at the end is going to address this directly. Mistake number 5, sleeping in a tightly curled fetal position. The fetal position: knees pulled up, shoulders rounded inward, chin tucked toward the chest. For many people, especially women over 60, this is the default go-to. It feels warm. It feels protected, like the body is wrapping itself in a hug. And emotionally, I understand the appeal. But physiologically, 3 things go wrong simultaneously. First, your lungs are compressed. The ribcage can't fully expand. Every breath is shallower than your body needs. Tidal volume drops. Blood oxygen saturation dips incrementally with every breath across a full night's sleep. Second, the blood vessels running through your hip joints and knees, particularly the popliteal vessels behind the knee, get bent and partially compressed. Circulation to and from the lower limbs is reduced. If you already have a tendency towards swollen ankles or poor leg circulation, this position makes both worse. Third, your neck is flexed. We've talked about what that does to vertebral artery flow and jugular drainage. All of the same concerns apply here, just through a whole body version of the same compression pattern. Research in respiratory physiology and neurobiology documented that sustained spinal flexion during sleep measurably reduces tidal volume, the amount of air inhaled per breath. Multiply a 10% reduction across every breath in an 8-hour night. And you're talking about significantly less oxygen delivered to already aging brain tissue? If this is you, if you curled up tonight the way you have for 30 years, the adjustment doesn't have to be dramatic. A body pillow between your knees and a slight opening of the hip angle. Small changes, real improvements. Mistake number 6, late eating, alcohol, close to bedtime. This one, this is the one that brings together everything we've discussed and amplifies it. And it's the most socially common mistake on this entire list. You finish dinner at 7:30, maybe a glass of wine while watching television, bed by 10, no more. That sounds like a perfectly normal evening for millions of adults over 60. Here's what's happening inside you while you sleep after that scenario. After a large meal, your body reroutes blood to the digestive system. Significant blood volume is redirected away from your brain and heart toward your gut. In younger bodies, the redistribution is seamlessly managed. In older bodies with less arterial elasticity and slower autonomic nervous system response, this shift can create transient drops in cerebral blood flow, moments where the brain is subtly undersupplied. Now add alcohol. Alcohol is a vasodilator. It relaxes and widens blood vessels. That causes your blood pressure to drop. Your body senses this and compensates by constricting vessels and raising pressure again. Blood pressure yo-yos up, down, throughout the night. And in vessels that are already dealing with some degree of plaque stiffness or age-related fragility, that oscillation causes stress on arterial walls. The American Journal of Hypertension studied this exact pattern and found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural nighttime blood pressure dip that healthy sleepers experience. Without that dip, overnight cardiovascular strain increases meaningfully. What does this look like in real life? You wake up at 2 a.m., heart hammering, sweating slightly. You think it was a vivid dream. You tell yourself you just need water. But what you experience may have been your vascular system trying to stabilize itself through a wave of pressure fluctuation it wasn't equipped to handle gracefully. The recommendation: finish eating at least 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before you sleep. Take a 15-minute gentle walk after dinner. Not exercise, just movement. That simple act begins digestion, normalizes blood sugar, and gives your cardiovascular system a chance to settle before you go horizontal. The 2 positions your brain actually wants: position 1, left side sleeping. This is without question the most evidence-supported sleep position for cardiovascular and neurological health in adults over 60. When you sleep on your left side, gravity works in alignment with your heart's natural orientation. The inferior vena cava, the vein we discussed, runs on the right side of your spine. Left side sleeping takes compression off that vein entirely, allowing blood to return to the heart from the lower body freely and efficiently. Your heart works less. Circulation stabilizes. But here's the discovery that truly changed how sleep researchers think about position. About a decade ago, scientists identified a system called the glymphatic system. Think of it as the brain's overnight janitorial crew. While you sleep, cerebro's spinal fluid pulses through the spaces between your brain cells, flushing out metabolic waste products, including amyloid, beta, and tau proteins, the same proteins found in excessive quantities in the brains of Alzheimer's patients. A landmark study published in the Journal of Neuroscience found that this glymphatic clearance is most efficient when you sleep on your side, and the left side appears to offer slightly better drainage geometry due to the brain's natural asymmetry and the direction of cerebral spinal fluid flow. This means left side sleeping isn't just about tonight's circulation. It's about whether your brain is adequately clearing the waste products that over decades accumulate into cognitive decline. If you've never been a side sleeper, use a full-length body pillow to support your front. It prevents you from rolling. Put a pillow between your knees to keep your spine neutral. Give it 7 days. Your body will adapt faster than you expect. Position 2, back sleeping with a 15-degree elevation. For those who truly cannot tolerate side sleeping, joint pain, shoulder arthritis, or simply decades of back sleeping habit, there is a safe, effective alternative. Elevating your upper body between 15 and 30 degree. Not just stacking pillows under your head, the entire upper torso needs to be elevated on a gradual incline. A wedge pillow works well. An adjustable bed frame works even better. What does this achieve? It uses gravity to assist blood return from your lower body. It reduces the pooling effect on intracranial pressure that flat back sleeping creates. It keeps your airway more open, which improves oxygen delivery throughout the night. And if you add a small pillow under your knees to maintain the natural lumbar curve, you achieve what sleep researchers call a zero-gravity posture, where pressure is distributed across your entire body evenly, minimizing strain on any single vessel or joint. This position is particularly beneficial if you experience mild sleep apnea, frequent morning headaches, swollen legs, or have been told your blood pressure remains high even while asleep. Position alone isn't the complete picture. Your sleep environment shapes whether your cardiovascular system recovers or labors through the night. Temperature. Keep your bedroom between 65 and 68 degree F. A cooler environment helps your core temperature drop. The trigger for deep restorative sleep. It also naturally lowers nighttime blood pressure. Too warm and your heart rate stays elevated, keeping you in shallow sleep stages where no meaningful cardiovascular recovery happens. Light in screens. Blue light from phones and tablets after 900 p.m. suppresses melatonin production and delays your entry into deep sleep. Your brain's lymphatic system, the waste clearance mechanism we discussed, operates most actively in deep sleep. Disrupt that, and the clearing stops. Put the phone away. Read something physical instead. Noise. Sounds that don't wake you fully still interrupt deep sleep in brief, invisible microarousals. Your heart rate spikes. Cortisol rises. These events don't register consciously, but your vascular system notices every single one. A white noise machine or earplugs can eliminate this variable entirely. One monitoring tool worth considering: an overnight pulse oximeter, a small clip-on device that tracks your blood oxygen throughout the night. If your oxygen regularly drops below 92%, that's a conversation you need to have with your doctor. It could point to sleep apnea, circulation issues, or early respiratory problems, all of which significantly increase stroke risk. This is data your physician will actually want to see. Here's what I need you to take away from this video. Your risk of stroke doesn't clock out when you fall asleep. In many ways, the hours between midnight and dawn are the most critical hours in your cardiovascular day. And the position your body is in during those hours is something you have direct, immediate, zero-cost control over. Pick one thing from today, just one. Switch to your left side tonight. Elevate your head 15 degrees. Stop eating within 3 hours of bed. Trade 3 stacked pillows for 1 contoured one. Any single one of these is not a small thing. It's a consistent nightly intervention that compounds over weeks, months, and years. Now drop a comment below and tell me, which change are you going to make first? Reading your answers genuinely helps me understand what you're dealing with, and it might help someone else in this community recognize a pattern they've been ignoring. If this video gave you something your doctor's appointment never has, please hit the like button and share it with someone who needs to hear it. A spouse, a parent, a sibling over 60 who keeps waking up with unexplained headaches. And subscribe right now, because next week I'm covering the 5 early morning symptoms that cardiologists say are far more serious than most people recognize. Symptoms that appear in the first 20 minutes after you wake up. Symptoms that are often dismissed as just aging, but that may actually be your body sending you a very specific warning. You'll want to catch that one. Until then, sleep smart, protect your brain, and take care of yourself. I'm Dr. Evans, I'll see you in the next